Hey everyone, and welcome back. Today we're tackling a topic that every nursing student needs to have on their radar: reproductive cancers. We're going deep on ovarian, endometrial, cervical, vaginal, and even vulvar cancers. Everything you need to know to provide amazing care to your patients.
It's a really important topic, and it's unfortunately pretty common. Did you know that cancer is the second leading cause of death for women in the U.S.?
Wow, that's right after cardiovascular disease, isn't it?
You got it. But the good news is that so many cancers preventable or detectable super early if we have the right knowledge.
That's reassuring. But when we talk about prevention, what does that actually look like day to day?
Well, you want to make healthy choices, and vaccinations are key too. Things like keeping a healthy weight, exercising regularly, and eating a balanced diet can make a big difference. Oh, and the HPV vaccine, total game changer for preventing cervical cancer.
Absolutely. Makes total sense. Sadly, though, prevention isn't always enough. Some people are still going to be diagnosed with cancer, and those reproductive cancers in particular come with some pretty unique challenges, wouldn't you say?
Imagine getting a diagnosis that not only threatens your life, but might also affect your ability to have children and really your whole sense of womanhood. It's a lot to process, physically and emotionally.
No doubt about it. It's heartbreaking. And it really shows how important it is for nurses to give more than just medical care. We have to be there for the emotional support and resources, too.
For sure. Helping patients navigate all the emotions that come with a cancer diagnosis, talking about body image and sexuality, those are all essential parts of good nursing care.
And it's not just the patient who's going through this, right? Family and loved ones are on this journey, too.
Exactly. So being able to offer support and resources to the whole support system is crucial. Sometimes just listening and offering a shoulder to cry on can make all the difference in the world.
Right. Before we jump into the specifics of each type of cancer, let's talk about gestational cancer. That's one we don't hear about as often.
Picture this. You're pregnant, excited about starting a family, and then bam, you get a cancer diagnosis. It's actually happening more now as women are waiting longer to have children.
Wow, what a difficult situation. I bet it poses unique challenges for the patient and the whole medical team.
Absolutely. The treatment plan has to consider both the mom's health and the baby's. The ones we see most often in pregnant patients are breast, cervical, thyroid, blood cancers, and melanoma.
Okay, let's shift gears and get into the specific reproductive cancers. We'll start with the one everyone's always worried about: ovarian cancer.
It's often called the silent killer, because the symptoms are kind of vague and easy to brush off, especially early on. We're talking bloating, feeling full really fast, fatigue, pain in the abdomen, changes in how often you pee, and weight changes you can't explain.
It's like a puzzle where we only have a few pieces. No wonder it's often diagnosed later.
Yeah, unfortunately, there's no reliable screening test for ovarian cancer. Like, we have the pap smear for cervical cancer, but not for ovarian. So taking a detailed family history is super important here.
Family history. How does that play into the risk for ovarian cancer?
Well, if a woman's mother, sister, or daughter has had ovarian cancer, her risk goes way up. And then there are certain gene mutations like BRCA1 and BRCA2. Those increase the risk for ovarian and breast cancer, too.
So as nurses, we really have to be detectives, asking all the right questions and looking for red flags. What specifically should we be asking patients about?
Besides asking directly about ovarian cancer in the family, ask about any history of breast, uterine, or colon cancer. Oh, and don't forget about genetic testing. If a patient has a strong family history, they might already have some important information about their risk.
This is where our job as educators comes in, right? Helping women understand their risk and be their own health advocates.
Exactly. And when it comes to treatment, surgery is usually the main approach for ovarian cancer, often along with chemo and sometimes radiation too.
Okay, let's move on to endometrial cancer. That's the one that affects the lining of the uterus, right? This one has a better prognosis though, right?
Yes, and often it's because we catch it earlier. The most common symptom is unusual vaginal bleeding, especially after menopause.
So, note to self, any bleeding after menopause is a red flag. Go see your doctor. What are some other things that make someone more likely to get endometrial cancer?
Prolonged exposure to estrogen without enough progesterone to balance it out, being obese, diabetes, and high blood pressure all increase the risk.
Ah, so those lifestyle factors are back in the picture. What about diagnosis and treatment? What's the usual process?
A transvaginal ultrasound is often the first step. And then if we need to confirm the diagnosis, we do an endometrial biopsy. The standard treatment is a hysterectomy, and usually we'll also remove the fallopian tubes and ovaries.
All right, we've covered ovarian and endometrial. Let's move on to one that's strongly linked to a very common infection: cervical cancer.
You're talking about HPV, right? Human papillomavirus. It's super common, like most sexually active people will get it at some point. But the good news is, most of the time, it just goes away on its own.
Yeah, but what happens when it doesn't clear up? That's when it can become a problem, right?
Exactly. If you have certain types of HPV and the infection sticks around, it can cause changes in the cells of your cervix. And eventually, that can turn into cancer.
And that's where the pap smear comes in, right? It's amazing how one little test can do so much to prevent cervical cancer.
It's seriously one of the best cancer screening tools we have. If we catch those abnormal cells early, we can treat them before they even have a chance to become cancer.
And speaking of prevention, let's not forget about the HPV vaccine. It's like our secret weapon in the fight against cervical cancer.
Absolutely. The vaccine protects against the types of HPV that cause most cervical cancers, and it can even protect against some other cancers as well.
Awesome. Well, everyone, we've covered a ton of information today. We've talked about prevention, how cancer affects people emotionally, gestational cancer, and even dove into ovarian, endometrial, and cervical cancers.
And before the break, we were talking about the pap smear and how it can detect those early changes in the cervix.
It's amazing how much info we can get from that one little test.
Mm.
But you know what always threw me off? That Bethesda system. Like, try to remember what all those classifications mean. Can you break it down for us? Something that'll make sense to nursing students.
Of course. Think of the Bethesda system as using a standard way to describe what we're seeing under the microscope when we look at those cervical cells.
Okay, standardization, always a good thing in medicine. But what's it actually telling us about the patient?
Think of it like grades for your cervical cells. It tells us if the cells look normal, if there are any changes that might be from HPV, or if there are more serious abnormalities that need more investigation.
So it's not a simple yes or no for cancer.
You got it. It's way more nuanced than that. Like if a result is ASCUS, it stands for atypical squamous cells of undetermined significance. Basically, it means the cells aren't quite normal, but we don't know for sure if it's HPV or something else.
So in that case, what happens? Should the patient be worried?
No, not at all. It just means we need more information. The doctor might want to do another pap smear a few months later or a colposcopy. That's where we can get a really good look at the cervix with a special magnifying tool.
Makes sense. So the Bethesda system helps us decide what to do next, like whether to do a colposcopy or maybe even a biopsy.
Exactly. And remember, even if the pap smear comes back abnormal, it doesn't always mean cancer. A lot of those abnormalities can be treated early before they even have a chance to develop into cancer.
Okay, good to know.
Yeah.
Now let's talk about treatment options for precancerous lesions or early-stage cervical cancer. What are we likely to see in clinical practice?
Cryotherapy is common. It sounds complicated, but it's really simple. We freeze the abnormal cells and that destroys them.
So it's like hitting the reset button on those cervical cells.
Perfect way to put it. Another option is a cone biopsy, where we remove a small cone-shaped piece of tissue that contains the abnormal cells.
And for that, they could use a LEAP procedure, right? With a heated wire loop, or they might use a scalpel or laser.
Yep, you got it. We also have laser therapy. It uses a focused beam of light to destroy the abnormal tissue. The goal with all of these is to get rid of the abnormal cells before they can turn into cancer.
So we're nipping it in the bud. Early detection really is key here.
Couldn't agree more. Now let's move on to those less common reproductive cancers we touched on earlier. We'll start with vaginal cancer. It's rare, but important to know about.
Absolutely. What are the key things we need to remember for this one?
Well, the tough thing with vaginal cancer is there's no specific screening test for it.
Yeah.
A lot of times it's found during a regular pelvic exam, or if a woman says she's having symptoms like unusual bleeding or discharge.
And again, listening to our patients and taking a good history is super important.
You said it. Treatment for vaginal cancer depends on the stage and type. But it could be radiation therapy, laser surgery, or, in more advanced cases, a hysterectomy. Sometimes we even have to remove part of the vagina.
Sounds like a really tough diagnosis,
Uh-huh.
physically and emotionally.
It can be. Which brings us to another big part of caring for patients with these cancers, the emotional and psychological impact.
You're right, we can't forget about that. These diagnoses affect such personal and private parts of a woman's life. As nurses, how can we provide that sensitive and supportive care?
One of the best things we can do is just listen. Create a safe space where patients feel comfortable sharing their fears, their worries, what they're hoping for without any judgment. That can be so healing.
Letting them know they're not alone.
Exactly. It's also really important to talk about how these cancers might impact a woman's sexuality and body image. These topics can be hard to bring up, but they're crucial conversations to have.
Are there any resources you recommend for patients who are struggling with these parts of their diagnosis?
Support groups can be a lifesaver. Connecting with people who truly get what they're going through, it can make patients feel less isolated and give them a sense of empowerment.
And for us, the nurses, how can we take care of ourselves so we can be there for our patients?
Professional groups like the Oncology Nursing Society have amazing resources and continuing education. And honestly, don't underestimate the power of talking to your colleagues, sharing your experiences, and learning from each other.
We're definitely stronger together, both the caregivers and the patients. Okay, before we wrap up part 2, let's talk about vulvar cancer. This one often affects older women who might not be as comfortable seeking care.
That's true. And because it's visible, vulvar cancer can really affect a woman's body image and self-esteem.
What are the warning signs we should look out for?
Itching that just won't go away, even with the usual treatments, is the most common symptom. You might also see changes in the skin, like redness, thickening, sores, and even lumps or bumps.
So any persistent changes down there, we need to get checked out.
Absolutely. Early detection is crucial, just like with the other cancers. The good news is that if we catch vulvar cancer early, the cure rate is high.
What's the usual treatment?
It really depends on the stage, but surgery is often the first step. If it's more advanced, we might use a combo of surgery, radiation, and chemo.
So early detection and quick treatment can really make a difference.
You got it. And as nurses, we're in this amazing position to be advocates for our patients. We can teach them about their bodies and empower them to get medical help when something feels off.
That's a great point to end on for part 2. We've learned so much today, from the Bethesda system to how these diagnoses affect patients emotionally. And we're back for the final part of our deep dive into reproductive cancers. So glad you stuck with us. We've covered so much ground already. But there's one more piece of the puzzle we need to talk about before we wrap up.
Absolutely. Genetics. Especially when we're trying to figure out a woman's risk for these cancers.
Yeah, genetics can feel kind of overwhelming, like a big mystery. What do nurses really need to know about it?
Well, think back to those BRCA1 and BRCA2 genes we talked about before. Those are the big ones you'll hear about a lot. If there are mutations in these genes, it can really increase a woman's chances of getting breast and ovarian cancer.
So if someone has a BRCA mutation, does that mean they're definitely going to get cancer?
Not always. It's more about understanding the risk. Having a BRCA mutation makes the risk a lot higher, but it's not a sure thing. And there are other genes that can play a role in reproductive cancer risk, too.
So it's like the odds are higher, but not a guarantee.
Exactly. That's why family history is so important. If a patient has a lot of family members who've had breast or ovarian cancer, especially if they were diagnosed young, we need to think about genetic counseling and testing.
That makes sense. But what happens when someone finds out they do have a BRCA mutation? What can they actually do with that information?
That's a great question. And it shows how important our role as patient advocates and educators really is. Having this information can help women make informed decisions about their health. Like, they might choose to get more frequent screenings, things like mammograms and pelvic exams, so we can catch any problems early.
So we're talking early detection if something does develop.
Exactly. And some women might decide to take medications that can actually lower their risk. Or they might even think about having surgery to remove their ovaries or breasts, to really lower their chances of getting cancer. These are big decisions, and we need to support our patients as they figure out what's best for them.
Wow. It really shows how important those conversations we have with our patients are.
It does, and that's why it's so important for us as nurses to stay up to date on genetic testing options and resources. The more we know, the better we can help our patients.
Speaking of new developments, what's happening in the world of reproductive cancer treatment and research? It seems like there are new discoveries all the time.
It's pretty amazing. Targeted therapies are getting more and more advanced. These treatments are like laser-focused on the cancer cells, so they do less damage to the healthy tissues around them, and that means fewer side effects for patients.
So the treatments are getting more effective and causing less harm.
Exactly. Immunotherapy is another exciting area. It's about using the body's own immune system to fight cancer. And we're constantly learning more about how things like diet, exercise, and stress can play a role in both prevention and treatment.
It sounds like there's a lot of hope for the future, even with such serious diagnoses.
Absolutely. It's an incredible time to be working in healthcare. And as future nurses, you'll be right there on the front lines, putting all this new knowledge into practice and making a real difference for your patients.
Before we wrap up, I want to go back to something we touched on earlier, the importance of compassion in nursing. It's at the core of what we do, especially when we're caring for patients with reproductive cancers.
I completely agree. These aren't just diagnoses on a chart. These are real people with hopes and fears, and we need to approach each patient with sensitivity and understanding.
So what does it look like to be a compassionate nurse in these situations? What should we aim for in our interactions with patients?
It's about being fully present with them, really listening to what they have to say, and acknowledging their fears and anxieties. And it's about fighting for their needs, making sure their voice is heard, and that they're getting the best possible care for both their physical and emotional well-being.
It's about seeing the whole person.
Exactly. Sometimes the most powerful thing we can do is just listen, offer a comforting touch, and share a human moment with our patients.
Those little acts of kindness can make all the difference.
Absolutely. So as you start your careers in nursing, remember to let your heart guide you just as much as your knowledge. That's what will make you truly exceptional nurses.
Well, everyone, that brings us to the end of our deep dive into reproductive cancers. I hope you feel empowered and informed, ready to take on the challenges and rewards of this incredible profession. Keep learning, keep asking questions, and never stop caring.
The world needs compassionate, skilled nurses like you. Go out there and make us proud.
Until next time, stay curious and keep on learning.